start first talking about the lymph node tumors. And remember, if you're looking up lymph node and you're trying to get to the site, like axillary or whatever, remember to think of the word gland. So lymph node, lymph gland, same thing to get to the site. The first group they talk about is the C81 through C88. Those are the lymph nodes, lymphomas, whatever. And the fourth character is going to give you more specific information about the type of lymphoma. Let's go look up lymphoma. These are actually easier to find. So lymphoma is on page 208. So you can see that fourth digit is giving you information about, like, is it a B-cell lymphoma? Is it Burkitt's? Is it Hodgkin's? Okay, that's what the fourth character is telling you. More specifically, what type of lymphoma it is. The fifth character is telling you about the lymph nodes that are affected by the tumor. So is it in the axillary? Is it intrathoracic? Is it intra-abdominal? And you can see on page 455 a lovely picture of your lymphatic system. Okay. So that's what those categories have. Fourth digit for more specific information, fifth digit for nodes. Okay. It does tell you that category C86 and C88 do not specify by site. And this is where, remember, if you have multiple sites, so if they're in both the intrathoracic and intra-abdominal lymph nodes, you're going to use a 0.8 for multiple sites. That's kind of weird because usually we try to be specific. Remember when we did burns, you code every single burn that can happen? Here they want you to use multiple sites instead of telling you it's in the axillary or it's in the intra-abdominal. So that's kind of unusual for the coding guidelines. Okay. Okay, the codes that you've been given so far, that C81 through C88, are malignant lymphomas, but you can also have benign lymphomas, and those code out to D36.0. And then it just kind of talks about some of the specific lymphomas. It's talking first about Hodgkin's, because that's a biggie. And that too originates from the lymphocytes. Can be treated with radiation, chemo, or stem cell transplants. Okay. So we'll be looking at some of those when we're coding procedures, how to code those. On the Hodgkin's, again, the fourth character is still telling you more about the type of Hodgkin's. You can see that at the bottom of the page. So is it nodular sclerosis, mixed cellularity? Okay, and the fifth character is still telling you about the lymph nodes that are involved. Okay, at the top of page 456 then, it's talking about non-Hodgkin's lymphoma. And they tell you that whether it's Hodgkin's or non-Hodgkin's, they have a similar presentation. Their clinical signs and symptoms are similar. And the way they differentiate is that the non-Hodgkin's lymphomas do not have the Reed-Sternberg cell. Did anybody have to take microbiology in life? Okay, this might be the only cell that I was able to identify under a microscope. Because to me, all those little cells look alike. You know, they go, oh, do you see the blue cell? I'm like, yeah, 100,000 of them. Okay. So, the Reed-Sternberg is really easy to tell because it looks like it's a face with two big eyes, only there's no nose or mouth. But it just looks like two big eyes looking at you. And it'll be bigger than the other cells around it. There'll be more than one, but I mean, there'll be this big face looking, these big eyes looking at you. So, next time you're on Who Wants to Be a Millionaire, they ask you to draw the Reed-Sternberg cell. You can do it, just big eyes looking at you.
What is that? That's a good extra credit question.
Yeah, what does the Reed-Sternberg cell look like? Don't put eyelashes on it though, or I'll think you're drawing eye bugs. Okay. The lymphomas, these lymphomas, same thing. They develop out of the lymphoid components of the immune system. You know that lymphocytes are the fighting cells, the fighting white blood cells. They're trying to fight off infection. They break down usually in the lymphomas. They'll talk about B cell lymphomas or T cell lymphomas. You'll hear that. They also break them down by how quick or how slow they grow. So we have aggressive, of course, which are fast growing, and I love this one, the indolent. The indolent lymphomas, which are slow growing. Okay. C82 through C85 is where these are going to code out, and the fifth character again is going to identify the lymph node that's involved. Okay. So you can see on this page they talk in particular about C82, which is follicular lymphoma. That's one of the slow growing ones, one of the more common lymphomas that you can have. And if you look further down underneath that next paragraph, you can see how they break it out. So the fourth character there is either going to divide it by the grade of the lymphoma or by the description of the follicle. So it'll tell you like it's diffuse, it's cutaneous, whatever. So again, you've got that same fourth digit for more specific information about the type of lymphoma, and then the fifth digit for the lymph nodes involved. It also shows you the codes for non-follicular, which is C83, and that breaks down by, is it B cell? What do the cells look like? Small cell, large, mantle cell. So they're just showing you how it breaks out. Okay. Those are all in the lymph system, right? All the lymphomas, the lymph glands traveling around. On the next side, we got the blood and the myelomas. So multiple myeloma is going to code out to category C90. And then all of your leukemias code out between C91 and C95. So the leukemias now are in the bloodstream. And notice the fifth digits here for all of those characters. Of course, they're not going to identify the lymph nodes because we're in the blood now. So they tell you whether the condition is in remission, or it's relapsed, or it has never reached remission. Okay, so that's what the fifth digit on the leukemias will tell you. It goes on to tell you that a relapse can occur while they're still getting therapy. So I guess maybe they got rid of it, but they're still on the drug and they go back into it. Okay? Or it can happen after treatment, can happen months later or years later. Okay? So a relapse, you have to base those fifth digits on the documentation from the physician. If it's